Yes.
I have a little bit of a specific question.
Yeah.
So you explained the differences in how the bills come through and how they get
Yes.
paid. So I'm curious as to when lobbyists and people like us can affect the changes that are going on. Is it like
Right
every
now,
state?
every second, until that thing gets down there.
And it's basically like if we're writing letters or we're protesting or lobbyists are throwing more money and swinging more weight,
It's all-
they just affect how members are voting and what they're writing, basically, right?
Yeah, there are opportunities. For example, right now, it's really amazing. Just found this out on Friday that one of the provisions that we had been working on and had looked at the language that we knew was going to be in the bill, and it came out around, whatever the million were. And when the CBO then on Thursday reported out their score, we looked at that, and the score had actually much more money that was in it. Like, well, we like that, but how the hell did that happen? So there are, in every step right now, there are opportunities. The battle royale right now is around the insurance reform provisions. So when we talk about who's coming in, who's going to be covered and how, there are a number of insurance reform provisions that were put in so those people who are insured but are underinsured have protection. And those, if you require every insurer to cover everybody that comes through the door, well, they don't want to do that. They want to cover the well people. They're not really that interested in covering the sick. So now you're requiring them to do it. It's going to cost them more. But you're also limiting how much they're going to be able to raise their rates. So there's a variety of things that have been offered to them. Like, well, we're going to have these big subsidies, so they're going to be able to afford it. Don't worry about it. Well, some of those subsidies, people are backing off on. So now the insurers are, wait a minute. I don't want to be on the hook for having to cover everybody and pay for all this unless something's coming back into my pocket. So they're fighting that battle. Big Pharma is worried about the donut hole. They're like, wow, wait a minute, that's not, what we agreed to. The hospitals are freaking out because they are thinking that now the mandate for everyone to have insurance is much softer. Yeah, you have to have it, but the penalty that you're going to have to pay if you don't get an insurance plan has dropped. Well, somebody your age is going to look at, how much does it cost you to buy a health insurance plan, and how much is going to cost you to start paying off your loan. You're going to be careful. You're going to eat well. You're going to look both ways when you cross the street. You might not get a plan. All right, that means uninsured people go into the hospital. They get happy about it. The hospitals are screaming. Chip Kahn's going nuts. He's with the for-profit hospitals. He was behind the whole Harry Louise ad stuff back in the early 90s and then Clinton reform. Chip's a real character. Anyway, so he's screaming like that. So I'm watching this going, okay. So everyone's kind of duking it out. There is a tremendous amount of duking that's still going on. You have enormous opportunity now to still influence what's going on. And just even letters. If your member wants to do the right thing, they need to be able to get up there and say. So they say, look, I got 4,000 nurses in my district. They all want to have support for education funds for advanced practice nurses. And I'm, count heads, I'm in a tight district. They figure it out. They need a reason to go up there. You not only are going to give them a policy reason, a social interest reason, but an electoral reason. Don't let them forget who you are. So you have great opportunity to give them the information. But remember, I started with, we have to be honest with what the message is. So don't do it for doing it. Say, or you may. That is not what I do. What I do is to say, these are the things that are good for Dad. My mother's actually healthy as all get out. My dad's great, but I worry about him. So I want it good enough for him. So I'm pushing like hell to make sure that we have things in there that are going to take care of him. Hopefully can take care of me. But, yeah.
I wonder, has the message has changed over the last 3-4 months? Because in the beginning it was about cost savings.
Yeah.
About how
that was insurance.
Skyrocketing. It was the CBO demonstrated that we weren't going to reduce the cost.
That's right. Because they wrote these big, huge bills to cover everybody.
In fact, it will cost us more.
Right.
And so the the rhetoric changed from prostate to the uninsured, and then that 47 million has been shown that it's really only chronically uninsured around.
Right, it's like take out the people who are illegals, and blah, blah, blah. Oh, yeah.
And now it's changed to a different set, but who's pushing that? Who's pushing the rhetoric?
Well,
it's not one set argument. It seems like it's
yeah, they started out with, well, if you want to defeat it, okay, then what you're doing is you're looking where the holes are in all of it. And they've got all their holes lined up. And what you're seeing from a media, it's a really interesting media spectacle. Because you watch what they say and then watch how the White House shifts its message. So now they're talking about insurance reform. So the people with the black hats are the insurance companies. Watch the ads. It's like when insurance companies win, you lose. You know, I watch these things when I'm on the treadmill. Watch all of these things so you can see where the messaging is coming from. So now what we're saying is, it's the insurance companies who are out to get you. And how do we combat that? And so the messaging is changing. The bills haven't changed that much, although things have been added. But the reason it costs so much is they're trying to bring everybody in and not bankrupt them. And the money's got to come from somewhere. And everybody wants to do everything and not pay for it. And it costs money to do things this way.
Because I view it as almost like pointing out they're evil, they're blood-sucking vampires, and
Right.
they don't care about your health.
Right.
And I view them personally as providing a needed service.
That's
and if
right.
they don't provide that service well, then they would be defunct.
Right. Well, I think, and that's why it's important to be able to have all of that out there. The insurance companies should be able to show what they've done and what they've done effectively. I mean, one of the things is that you all are used to, for a $5, $10 copay, go in and have all your preventive care, your pap smear and all of that. That was never a part of insurance when I first was getting insured. That was all out of pocket. All you paid for, all that was paid for you for hospitalizations, considered major medical, catastrophic major medical coverage. Kind of like your car. Your car insurance doesn't pay for a tune-up. It doesn't pay for the oil change when you get in an accident. That's how insurance was, health insurance was. Now, managed care has actually created a much better opportunity and reduced our out-of-pocket. Incredible.